Good morning, class. Greetings to you all. I'm coming to you live from the sunny, beautiful Panama City Beach, Florida. And so, at last, we finally made it to our final discussion post of this program. And I couldn't be more excited. We're talking about nursing advocacy, and we're going to give a definition, some examples, and what it means to be a good nurse advocate. Clearly defined, advocacy in nursing is defined as an act of safeguarding, apprising value, mediating, and championing social justice in the provision of health care. Advocacy for vulnerable patients is a complex process and one that requires professional nurses, rules, and supportive managers. And this is according to Muhammad Abyssinia, an article I found in the Sage Journals. Advent Health University also states that nurse advocates serve as liaisons between patients, their physician teams, and other healthcare teams and facilities. For example, we may go over a treatment plan with patients after the doctor has prescribed a new medication or made a diagnosis. Maybe they don't quite understand, and we step in and we, facilitate that education. If a patient doesn't understand their condition or diagnosis, the nurse advocate clarifies it to them and their family members. And as nurses, we have many such occasions where we are the advocate, whether it's reiterating physician plans, like I mentioned, helping a patient understand newly prescribed meds, all these different things, checking. Also, I got to throw in, checking a physician when they're about to order something that isn't quite, maybe a patient's allergic to it. We've seen that, right? They're getting ready to order, morphine, and they're allergic to morphine. All they can take is Dilaudid, right? We've seen that many times. So we have to check them sometimes and keep them on track. But that's part of what we do. That's the nursing advocacy. We're that midline filter. And the value of good nursing advocacy is essential to the quality nursing care and, of course, the optimal patient outcome. Now, everybody in this class, I'm sure, has, a story or three to share about how they've been an advocate, how they've impacted nursing care, whether it be through language translation, medication education, or why a patient needs a certain procedure that they don't quite understand. I look at advocacy as being among the top priorities of nursing care. And I'll take a moment to share a story with you. When I was working in progressive open heart recovery, I had a patient that was fresh from a coronary artery bypass graft. She had received 5 grafts that morning. And, she had been doing great. Things were fine. First, 2 or 3 hours of the shift. And then, she starts telling me that she's having some chest pain a little bit. So, I was still a little bit new at this time, so I just started thinking, Mona, chest pain, Mona, right? Morphine, oxygen, nitrates, aspirin. So she was already on oxygen. I may have bumped that up a little bit. I can't remember exactly. And she also had a nitroglycerin drip running, so I wasn't worried about that. So I had the other 2 options, morphine and aspirin. She had a low dose of morphine ordered, and I had already given her aspirin that morning, so I chose to go with the morphine. I think it was maybe like a 0.5 dose or, something small. Checked her about a half an hour. She reported no relief, so I knew I needed to talk to somebody in her physician team. And the attending, after I talked to them, they suggested I contact cardiology. I attempted to reach out to this cardiologist multiple times. I remember at least 4 or 5 times I paged this cat. No answer. Couldn't get a hold of his nurse practitioner. So luckily I remembered that I had a friend that worked in cardiothoracic surgery. She was a nurse practitioner. And so I just called her. She wasn't even on board for this patient, but I called her to see what I should do. She said immediately contact the MET team, which was our medical emergency team, and then also contact her CTS, cardiothoracic surgeon. And so that's what I did. And once all that madness calmed down, I found out several hours later, that one of those 5 bypass grafts had failed. And so ultimately they let me know that my relentless pursuit of getting help for this patient helped to save her life. So in conclusion, patient advocacy comes in many forms, and the key takeaway is always the same in every scenario. As nurses, we spend the most time with these patients, and as any member of the healthcare team, and therefore establishing quality patient relationships and learning from each other throughout the shift, it's critical to patient advocacy, especially in a state like West Virginia. And I mean no disrespect by this, but it is what it is, right? The state is largely under or uneducated, and we need to be there. We need to be that filter between them and their physician team. So lastly, I'll say congratulations to all of you for completing this program. It's been quite a challenge, and we should all be proud of our accomplishments. Thank you all for those I've worked with. It's been excellent, and good luck to you all in your future. Thanks.